Hi, everyone. We are Team Jetlag Airlines here to present our findings focusing on non-smoking lung cancer mortality rates among Asian American subgroups. Currently, most literature concentrates on only smoking-related lung cancers. This, however, overshadows much-needed discussions around non-smoking lung cancer, which has been revealed by new preliminary studies to disproportionately affect Asian American females more. Hence, our study's main objective is to examine the mortality rates of non-smoking lung cancer and their respective trends in the Asian American subgroups in comparison to smoking lung cancer mortality rates.
Our study is a retrospective observational study. Through the American Community Survey, we acquired estimated population totals of Chinese, Asian Indian, Vietnamese, Japanese, Korean, Filipino, and non-Hispanic whites in the U.S. From the National Center for Health Statistics, we obtained mortality data from the same listed population groups. All data extracted was from years 2014 to 2020 and had breakdowns by race, sex, and nativity status. We then matched the smoking status with lung cancers based on their classification codes used in the 10th revision of the International Classification of Diseases Codebook. From here, we calculate the AMRs, or age-adjusted mortality rates, performed longitudinal trend analysis, and calculate the proportion of non-smoking lung cancer mortality among all lung cancers.
Presented on the bottom left is a figure characterizing the proportions of non-smoking lung cancer, which is colored in red, and smoking-related lung cancer, which is colored in blue, among all lung cancer mortality rates in female Asian Americans. Non-smoking lung cancer accounts for over 50% of all lung cancer mortality in the Asian American female population. Chinese American, Asian Indian American, and Vietnamese American females appear to have more than 80% of their lung cancer mortality rates attributed to non-smoking lung cancer.
Here in the top right corner is a figure showing the mortality trends for non-smoking lung cancer across all races, broken down by sex. We see that the blue trend line representing the female groups is much higher on the AMR axis than the orange trend line representing the males. This shows that non-smoking lung cancer affects female populations more than the male populations. However, we want to highlight that there is an increasing trend for non-smoking lung cancer mortality for both male and female populations. The figure below displays smoking-related lung cancer AMRs broken down by sex with the same color coding. Unlike the non-smoking lung cancer, we see a decreasing trend in the AMRs for both sexes in smoking-related lung cancer.
The proportion of non-smoking lung cancer death is significantly higher in Asian American female subgroup than their non-Hispanic white counterpart. This is especially true for Chinese American, Asian Indian American, and Vietnamese American female groups. These unique lung cancer mortality patterns suggest that Asian female may have different genetic or environmental risk factor for lung cancer compared to their non-Hispanic white counterpart.